we need to get together and let our voices be heard.
This is Buffalo What's Next. I'm Jay Moran.
I'm Bridget Jaipal Valenza.
I'm Dave Debo.
And I'm Thomas O'Neill White.
After May 14th, how can we afford not to talk about race?
About education, about segregation, about humanity.
Since the dawn of this nation, racial violence has existed.
The way we have designed our society has a big hand in what occurred in that Tops Market.
The suburban area, everywhere. We must work and teach our children.
We need to make sure that we put more funding in our programs that help prevent gun violence and more money into art.
If we're going to have some real healing, we've got to have space to tell some uncomfortable truths.
And good morning. Welcome to Buffalo What's Next. I'm Jay Moran. Coming up later in the program, Dave Debo will take a look from a couple of different perspectives at some of the fear about going back into the Jefferson Avenue Tops Market since it's reopening. But in our first segment, we're going to talk with Terry Jones. Terry is a filmmaker, and also he's going to be the curator, or is the curator, I should say, of the Haudenosaunee Micro-Short Film Program that's coming up at the Birchfield Penny this Saturday. Terry, thanks for joining us.
Thank you so much for inviting me.
I want to hear about this because you're going to, 14 different, and we're going to call these our micro-short films, so less than 5 minutes, all produced by Haudenosaunee artists.
Mm-hmm.
Yeah.
Last year I was asked by two film festivals. One is Micromania Short Film, or Micromania Short Film, or Micro-Short Festival, and Native Spirit in London, England. They had wanted to do an Indigenous part of their program. And since the Micromania Film Festival is based in Buffalo, they said, why don't we have Seneca? And it turned out both of the directors of the film festivals knew me personally, so they asked me to come in and curate. At first, I thought it was going to be a little bit I thought it was more administrative doing curating. But then when they mentioned that they were going to pay screening fees to the filmmakers, I thought, oh, that's a great opportunity for me to come in. And I just put a posting on Facebook and asked for submissions to the Micromania Short Film Festival or Short Film Program, and I think I got a good response. I got 12 films. I took them all. I didn't have to leave any out.
And then I think one of the Seneca Casino picked it up and actually brought it to their facility as well, right?
Yeah. So we screened last year at the Birchfield Penny. We had a great turnout. The CEO of the Seneca Niagara Casino was there. He came in. The program was, I think that was 12 films over 35 minutes. But it was sort of the way the films spoke to one another. I had also edited how the screening order, but it really found this unique way of having this journey of all these different short films. And when they saw it, it was really emotional for everybody. And he says, I want to bring that to the casino as part of their Native Heritage Month in November. So it was great. They were able to provide more funding, especially to bring out-of-town filmmakers in. So it actually we screened at the Bears Den and had a great turnout there as well. So then we're doing it again this year as well.
Now, I want to get in a little more about the themes that we're going to be hearing and seeing on Saturday, but I also want to just give a quick plug out to Lukia Costello. Couldn't be here because she's feeling a little under the weather, but she is the one who is bringing the Micromania Film Fest to Buffalo, and with a lot of different sessions coming up in the coming weeks. You want to find out more, you can go to sparksfilmmakers.org. But we're with Terry Jones right now. And Terry, these films that we're going to see on Saturday, what are some of the themes? I wouldn't say necessarily is there one theme or two themes, but what are some of the themes that emerge? Because a lot of this is self-representation. That's the idea that we want these filmmakers to put together something that says something about themselves or shows what what they are feeling and expressing.
Mm-hmm. One of the things that when I started to curate this program was that I wanted the casual viewer to be able to come in. I know they would already come in with their preconceived notion of what a Native film
we've seen in other films for 100 years, right?
Exactly.
Okay.
And what I wanted to do here was to have a wide array of Haudenosaunee filmmakers and filmmaking styles, which included narrative, experimental, documentary, dance, animation, and that's sort of what we got. In this year's program, there's my personal film that I included is called Savage Future. It's an experimental film where I used I shook Iroquois white corn as a soundscape and slowed it down, and then I just created very simple images of my own personal family's experience with the Thomas Indian School or the residential schools, and on a micro level, and then the story makes it go macro, and I bring it back to micro. And there's another film in the slate that's a trailer for a longer film called Remaining Native. I think she's a Six Nations filmmaker, Paige Bethman, and there too is a theme of Indian residential schools. So I thought those two would play really well together. Another big thing that I really like this year is that we have 4 youth films made by Haudenosaunee youth. One is from a 12-year-old Seneca who did a 30-second animation. I was blown away by how I wouldn't even be able to do that sort of animation. Another one was created during the summer of a theater camp that I was an instructor on. To the participants wanted to make a short film. It's called Massa Cookie Massacre. It's about a.
I'm sorry for laughing.
It's a comedy horror film. They came up completely with the idea. I brought in. I was more their mentor. I helped them with the logistics of it. But in the end result, I liked the film so much that I actually programmed it in with the program that's going to be shown at the Birchfield. Another one I think is a longer form. I'm not really sure what exactly it is. It's a trailer, but it was one of the participants who has a film here, Paulette Moore. She had conducted a media workshop over the summer in Six Nations Reserve, and there too they made a long form film, but they included a trailer that we're going to show as well.
It's interesting to hear, like, for example, I'm sure you have experience in making films, but not everybody necessarily is all that experienced that are putting together these micro short films. Is that part of the concept, that you want to try to see what other people can do and how they can express themselves?
Yeah, one of the good things as well with this program is that when the filmmakers are able to come to the screening, a lot of times these are just done in our own laboratories on where we're from. We have the concept with the idea. We find the way to tell the story. Sometimes you might not have like a Hollywood style glossy film product in the end, but good storytelling. Sometimes you don't need that. Sometimes the DIY format works really well, but there are a fair amount of these projects are really top-notch. A few of them feel amateurish, but that's okay. That's part of the process. The idea is to amplify not just established filmmakers like myself, but emerging filmmakers, especially youth filmmaking, that when we're all in the same room, we're able to say, wow, we all learn and inspire from one another. And not only that, but we also include the general audience to take part as well, which includes our own community, but also our neighbors, the Buffalo community, to allow them to come in and learn something new, especially in a space where we weren't necessarily really included or invited into, like the Birchfield Penny. It's so really grateful for them for providing the space, because I wouldn't know where I would be able to have that sort of built-in audience community, artist community to come support the program.
And I guess then, to take that then, do we see, I mean, you've got experience, do we see an emerging sense of this artistry coming from Haudenosaunee or Indigenous people? I mean, is that so? I mean, we're hearing a little more conversation, but are you actually seeing it?
I do, but like I said, sometimes for me, we're dealing with people's notion of what a native film feels like. So in order to dispel that, it's not presenting these stories, these very unique personal stories, in a way that we feel people need to see it. They do it. It's a form of self-expression that just is. So then when we invite someone to come and look at it, they're like, wow, I didn't know that. A story is a story. It has a beginning, a middle, and an end. Hopefully it has themes or characters that are universal, and we all do. when I think of storytelling as an Indigenous, doesn't make us any special. We all want the same thing. We want to take care of an environment. We want to take care of the kids. We want to take care of who's here. We want to plan for the future. We want to take care of our elders, and and we want to respect one another and respect the environment. And that's pretty universal that anybody can identify with. So with these sort of film projects, hopefully they'll go in and say, I understand that. Even though they're Indigenous, I understand that story. I can relate to that story.
Obviously, if you're talking about the residential schools, there's just such a history of pain and again, things I think that the general public are just still finding out about. But what about in terms of, do you sense hope coming out of these? Or do you see that type of thing inside the artistry again that you're seeing out of these micro-short films?
Yeah, especially when it comes to something like Indian residential schools, for me it's entertaining, but it's also educating at the same time. I'm sorry, I'm just blanking out.
Yeah, but is there a sense of hope? I guess is what I'm saying. That this is on the road to something better.
Yes, yeah. For me, when I tell these. I call them sometimes difficult stories. History is history. It's in the past, but we can learn from history. There's that whole thing where we're bound to repeat history unless we learn from our past. For me, my particular piece called Savage Future, it's a deep subject. It's a dark subject. It can be a dark subject, but I've heard people who've watched it and they feel like there's a sense of hope in for it. So for me, it's a sense of me being able to express this difficult history to a casual viewer, but at the same time, in the end, hopefully they'll walk away with a sense that, as I said, we're universal.
So 14 films cover about 45 minutes.
Yes.
Okay, this is going to be on Saturday at the Birchfield Penny. It is the Haudenosaunee Micro-Short Film Program at 1 o'clock at the Birchfield Penny. I also want to give a shout out to Lukia Costello of the Micromania Film Fest. She couldn't be with us. You can find out more about the Micromania Film Fest at sparksfilmmakers.org. Terry Jones, thank you very much for joining us today on Buffalo What's Next.
Thank you for having me.
And most certainly it was a pleasure. This is Buffalo What's Next on member-supported WBFO.
This is Buffalo What's Next, where we have conversations with the community about moving forward. To have your voice heard, press the Talk to Us button on the WBFO app, and we'll work to get your questions and comments on the air. Join us on Twitter at WBFO or email us at news@wbfo.org. Together, we'll have the conversations that are needed. This is WBFO, your NPR station.
And this is Dave Debo. Let's talk now about coping and the community around the Jefferson Avenue tops. Mulaney White is with us. She's a licensed mental health counselor with Spectrum Health Services. Mulaney, thanks for being with us.
Thank you. Thank you for having me.
Tell me a little bit about the Tops supermarket itself. Have you gone back? Have you encountered a lot of people who say they are never going back into that store?
I have not had the opportunity to go back to the Tops yet. It's such a phenomenal thing. I was out in the community doing some running, but it kind of made me double back and think about some of the conversations I do have. Some of the conversations lately have been about, a majority of my clients saying that they, will never go back in. And we have in-depth conversations about that, and what that looks like.
The reason I asked is because I think it's an illustration of the fact that fear is still there and trauma has not gone away.
Sure.
Even though it's been 3 months.
Sure. 3, months.
Yeah.
They're words, right? Has nothing to do with emotions, has nothing to do with pain, has nothing to do with the struggle of knowing someone, being a family member, engaging in the conversations around trying to enlighten and heal. So 3 months is nothing. It's no time at all.
And you're hearing that from people, from clients.
Community, okay. Clients, community. Just having conversations in environments where people are talking. Some of them are saying they're afraid to go back in. Some people seen some videos. right? And others just can only imagine. And so that fear says, I don't want to go back. And so some of our conversations are, when we talk about it, it's like, okay, sure, you don't go back in. Then what? So then we talk about empowerment, and we talk about courage, and we talk about fear, and how fear can be so show-stopping, right? To help them come to a place of seeing it. That's that psychotherapy, talk therapy, talking it through.
Relive it. Oh, that does sound rough.
Sure. But fear is grand and depending on what situations have happened in a person's life.
How do you talk someone through it without necessarily triggering them?
I don't think I so much as worry about trigger, because anything can be a trigger, right? So I kind of try to put that to the back of my mind, because then that is what stopped me from doing my job, right? You say don't talk about certain things because you'll get a response. Well, right now, if we're talking about therapy and we're talking about healing, then we have to talk through some things and not worry about the re-triggering part, because
you got to have the response and then move through it beyond it.
We have to. It's a process. It's a process. And yes, can a person be re-triggered? Sure. Just in the conversation, just by writing down Jefferson, just by hearing someone else. How about the news, right?
Yeah.
So yeah, you're going to be triggered by multiple things, but in order to work through the trauma and reprocess, and that's a part of that conversation about the EMDR, the trauma therapy, right? Reprocessing, trying to go back through and, manage those emotions and feelings that are related to that trauma that you've experienced in your life.
Talk to me about what EMDR is. Eye movement desensitization and reprocessing.
So a person comes to you and not just says something about the Twin Towers. That's an example, but let's go even further back. Childhood experiences, death, victimization of some kind, abuse, assault, right? Something that they've held on throughout their lives, throughout childhood, teenage years, young adult, older adult, okay? And they hold on to it. And it's caused so many significant negative events in life and still current day. And so they come to the table and want to have some therapy to be able to work through those emotions and feelings. And so we sit down and I will have the person sitting directly in front of me like you are. And I'll use my right or left arm depending on which arm it is. We'll begin with, I'll use my two fingers, I'll put them up, I'll do a wave in a manner, right? Asking you to make sure that the eyes follow my fingers.
As you go from left to right, I should turn my head, or at least my eyes should follow.
Eyes should follow.
Okay.
And then in that process, while you're doing that, what we started off with was, what was the problem? What happened? This is the re-traumatizing you were talking about. This is me taking them to that place where most people try to stay away from. So going back to that problem, to talk about the problem, to talk about, now, how do you feel now? How does that make you feel now? Let's rate it from 0 to 10. Oh, okay. What is a security blanket you would have to help you if you need it? Resources, a friend. Hey, how about a cloud? How about a puffy pillow?
How does the eye movement come into it, though?
So as we are talking, as I explain to you that it starts with the problem, then I start the eye movement. I come down, we take a breath, and I ask you what came up. What are your thoughts? And then you would then tell me what some thoughts were related to this problem, and then we would continue to do sets over time. Continue to do sets. That lasts probably about 45 minutes or so. And then in that process, that person would have reprocessed some thoughts based around that problem. Now, are we saying that a person gets it immediately? Sure, in some cases people do.
But not necessarily.
Not necessarily.
Without violating the sanctity of the relationship with your clients. What kind of problems are people still having?
Well, of course, some of them were family members. Two people
grief.
Who passed away, right? So definitely grief, right? And I have some who are angry, and don't know where to place that anger because all they do is come home and go back to work and come home. And so that's displaced anger. And how else do you express it? Sometimes people don't have outlets like the radio or the outlets like going on and screaming to the world or having a bullhorn where people are in front of you. So some of that anger is just still there. Sadness, definitely. Definitely sadness.
Is there a racial component? This gunman targeted people that looked like you.
Sure.
I would think that if I was targeted because of the color of my skin, because of no real reason at all, that would be harder to get over. If I could rationalize and say, oh, well, the attack makes sense because A or B or C.
It makes no sense. My great-grandbaby's grandbaby will say the same thing in time to come when I'm long gone, that this makes no sense. My color, it's my color. It has nothing to do with life experience, goal setting, adding to the world. How about the fact that I just add to the world? I am a part of what makes this earth tick. And so I think it is a senseless thing, no matter where we come from. And I do have clients who are of, a multitude of backgrounds. Black, Puerto Rican, white, Hispanic. I have a multitude of clients. There are quite a few of all of them are pretty upset and sad and frustrated. White, black as well.
Part of the reason why I asked the question is I'm wondering if it is harder because of the racial component.
And on the black people, it brings that last final question of when does this finally stop? When does it finally not make a difference? What do we have to do? Why are we not the same? So it does make a difference. And then we're talking in those conversations, and those conversations even go back in history. Right? We started even talking about slavery when we started going backwards and start talking about Black Lives Matters. And this hateful crime has really hurt people today, and it will for a long time to come. So 3 months this is nothing. Thank you, community, for providing things that needed to be provided in such a travesty. But it must keep going in order to really, truly help.
And Mulaney White is with us. She is a licensed mental health and substance abuse counselor with Spectrum Health Services. You kind of alluded to it in your last answer right there. The community, apart from people's individual mental health needs, the community needs to have, obviously, the bigger, broader discussion. Talk a little bit about that.
Yeah, and I know that there have been some conversations, right, happening since I know that they're doing a lot of things over at the library there. So, yes, I think the conversations are happening, but they have to continue. I don't know how big they have to be individually, but I think if we continue the conversations, though, then we might have a better chance at least getting to a different place, a niche of a different place, because it is an individualized thing, right? So it's like about self-care, who you are, because if we're talking about going beyond this person who done this horrific event, then we're talking about healing for the Black community, but we also are talking about awareness and enlightening people. If we continue to small groups and continue to try to rally just the conversations as much as possible, I think we're getting to a better place.
Talk to me about the guy in Arcade or the guy in Orchard Park or Williamsville. How do we broaden the discussion to white people in the suburbs?
In my eyes, I continue to talk about the school districts and what I think needs to be implemented in the school district. I know that there are guidance counselors, but I think there needs to also be some type of mental health guidance as well in schools. I think that there needs to be some open dialogue.
So the race discussion could take place as part of the statewide mental health curriculum?
Sure. We're talking about widespread. Children even in Arcade come to Buffalo. And we talk about relationships, and we talk about young people getting together and friendships. So I think, yes, the school district could be a great resource to help us spread the word through young people. It would be nice to change the hearts and minds of some older adults. But younger people, I think right this moment, really need to have some awareness and be engaged in the real conversations.
I almost wonder if just time is not what will heal things, because I think of my mom, and she is a product of her age, And I think of my nieces and nephews and my own kids, her grandchildren, and they are of a different mindset. And you look at the generations and the fact that over time, attitudes about race evolve. Is therefore time just the solution? We can wait this out, Melanie.
No. Time is not going to be the only thing that's going to be able to help this, because then my grandmother, who was 100, would look and say, yes, some things changed. Yes, there was a black president. Yes. But there were many things that have not. Right? So who's to say it weighs out? Who gets to say that it weighs out?
And then the other part of the discussion, and you wouldn't be the first guest to say this, we obviously have to look at resources on the east side.
Of course. Yeah.
How do you picture that?
Yeah.
What has to happen there?
In this small radius that we have in Buffalo, there could be a lot more resources added just to make sure that we are, even if you just want to use the small word, okay, right? Because remember we're talking about, we're saying we are the ones affected. We are the ones being haunted. We are the ones being stalked down, right? If that's the case, then we should have some free mind to feel like, okay, I can breathe though. I'm okay though. Imagine being afraid to walk around the corner because somebody might see the color of your skin and shoot you. For something like this to happen, that promotes that type of thinking, right? So yes, I do believe that all over this city of Buffalo, we should be able to have some awareness, some conversations, some people talking. On the radio, on TV, we should just really be soaking it in, because there's discrimination is just like, let's hide from it. Let's put some resources in so we can be more united, more unity, right? Because there's the outskirts of Buffalo where some people don't want to go. Black people won't want to go. There's some outskirts where they're like, maybe we shouldn't go out there. But, when do we get to a place that we shouldn't have to feel like that? Well, that's by uniting, coming together. And we know it because not just a march happened, but we keep marching. And we keep talking. We talk about it in our office, and we talk about how do we help heal each other. It's by saying, how you doing today? It's by uniting in just the comfortability of saying, it's a good day, Melanie. How's everything going? How are you healing? That's okay to say. Dave, that's okay to say. But in the neighborhood, it can become unseen and heard if people don't continue. So you have to continue, and you have to promote and motivate, not just those on the outskirts, but them too, because we don't want Jefferson Avenue to become stagnant.
Right.
This is a thriving time. Keep coming to Jefferson. Keep coming to Buffalo. Let's keep talking. Let's talk around Virginia and Missouri, and let's talk in Texas. Let's talk in places where we know all of these sad killings, events are happening. Let's keep talking so that way so these children can hear us.
Are you optimistic?
I am.
Tell me why.
My grandmother survived. She lived to 100 years old. I believe that if we unite together, that we can do this. Like I said, yes, my black clients are very sad and upset and worried. But my white clients don't come in like not wanting to see me, nervous about seeing me upset. No, they're inviting. They help me see that, we can talk about this. It's okay. We talk about this. And so I think if in the community, if we continue those conversations and not just let it be a beautiful tops and they put some nice things in there and they open it back up and there's some dairy and, some good proteins, that's nice, yes. But let's keep up the conversations so people cannot penetrate us. So an outsider cannot come in and just do what he done, because all of us will be on alert, because all of us will have each other's backs. That's so important for mental health, is to not worry. You don't worry. Why should I worry?
Melanie, thanks so much for your time.
Thank you.
Melanie White is a licensed mental health counselor with Spectrum Health Services. This is Buffalo What's Next on WBFO.
Watch the WNED PBS original production, Niagara Falls.
Visit a place that is a symbol, a shrine, a theme park, a natural wonder, and the world's capital of romance, Niagara Falls.
Now streaming on YouTube and the PBS video app.
This is Buffalo What's Next, where we have conversations with the community about moving forward. To have your voice heard, press the Talk to Us button on the WBFO app, and we'll work to get your questions and comments on the air. Join us on Twitter at WBFO or email us at news@wbfo.org. Together, we'll have the conversations that are needed. This is WBFO, your NPR station.
And this is Dave Debo. Dr. Willie Underwood is with us today. He's a Buffalo area urologist, but I think more important for this discussion, he is the director of the Buffalo Center for Health Equity, and he's also a chair-elect of the Board of Trustees for the AMA. We've talked about health equity in the past, but it's a big enough issue. We'll take one more bite at the apple here with Dr. Underwood. Thanks for being here, sir.
Oh, it's my pleasure to be here. Thank you for having me.
Again, social determinants of health mean that blacks in the Buffalo area, and I imagine across the nation, have worse health outcomes.
We know that there are 5 zip codes in Buffalo that have a mortality rate of disease that is significantly higher than the rest of the city, the rest of the state, and the county. Some of those estimates are about 300% higher. And those are zip codes 04, 06, 11, 12, and 15. Is this a unique problem to Buffalo? No. And it's a global problem. So let's look at what that global problem means for the United States. It means when you look at loss of life, when you're comparing just because black people are treated differently within the system. Look at David Satcher's work. It's about 86,000 additional deaths per year due to the fact that blacks are not treated the same way whites are treated in the healthcare system.
David Satcher, former Surgeon General.
Former Surgeon General,
okay.
Correct. When you look at the cost of that, it's been estimated that the cost of racial inequities in health and health care is about $400 billion a year. When you look at the total cost, loss of productivity and negative impact to our country, it's up over $1 trillion. So this is not, it's a Buffalo problem, but it's a national problem, and that impacts us all.
When you say not treated fairly by the system, are you talking the healthcare system or life, systemic racism?
I'm talking, when I say system, I'm talking about equal care within the system. Example, 2 individuals walk into an emergency room with the exact same symptoms, they're treated differently based upon race, gender. We know about race, we know about gender, we know about perceived sexuality or sexual preferences. All these things impact the way you interact with the system.
What does that look like? Describe for me. Someone sees a black patient and makes him wait longer? What kind of things go on?
Well, I can tell you my own personal story. This is not overt conscious issues. These are subconscious, implicit bias sort of behavior.
All right.
So, for example, I went into an emergency room with motor loss in my left leg, sensory loss in my left leg from a disc pinching on my nerve, causing left leg paralysis. And I was treated as though, and actually told to the point that I was a drug seeker, despite the fact that the guy is sticking a needle, multiple needles in my leg, and I'm not even responding to him at all. And the idea that I'm faking this is absurd. But not only that, though, once he was informed that I said, listen, I need to see the head of the ER, the attendings covering me. I no longer want to see you. You know, I'm a surgeon, this, that, and the other. He went and told the ER attending he claims to be a surgeon. You know, and then when the ER doctor realized who I was, he was quite upset. But, however, that happens. It just didn't happen to me. It happens to us.
You were stereotyped because black people are on drugs, et cetera, et cetera.
Correct.
Okay.
Correct. And even though the evidence, and this is what prejudice does, it makes you see things through a distorted mirror. And that, on both sides of the mirror, it's being viewed from a distorted lens. And that distorted lens impacts the society at every aspect of society. And that intersects between other aspects of society, like the educational system, the prison system, the fact that we don't have grocery stores in these communities, the economic system, how banking works, all those things negatively impacts the health of communities. Okay?
Those things are separate and in the community and cause health problems. But the aspect of this discussion that I think you're bringing to the table for the first time, for me at least, I've never heard it before, is that the healthcare delivery system has some intrinsic problems too.
Yeah, but they're both. Now, here's the interesting thing. When you look at it, and there's huge data on this, the greatest impact is on the other side.
The social determinants.
Correct. So we need to fix the system. The system is grappling with that now. But if we do not impact the other aspects of society, we still will suffer at the great cost that our nation is suffering from. This is a productivity depleter, and it leads to deaths. You know, we talked about people are outraged about the deaths at the Tops Market, and they should be. That should never happen. But at the same time, 86,000 people should not die because they're black and they're not treated the same, right? In any aspect of society. So be it you just look at poor health and you say, well, what are the causes of that poor health? And then when you interact with the system, how does the system work? The healthcare system is no different than the educational system, than the prison system, than the justice system. I mean, I'm a 57-year-old, highly educated, highly successful, financially successful male, but yet I fear interactions with the police and they will result in my death, right? And the interactions that I've had with them, despite not being a criminal, has led to guns being drawn and fearful of me dying, right? So that system works like the healthcare system. Healthcare system works like that system. Being in the classroom, I watch how my daughter has been treated in the classroom, which is no different than how I was treated in the classroom, despite being someone who desired to do great things, desired an education, wanted to learn, wanted to grow. But the system worked the exact opposite of what a so-called educational system should do.
Would the solution be, and I know this is incredibly simplistic, but I think it's something we at least have to mention, more black officers or more black doctors, more culturally sensitive people in whatever delivery system we're talking about?
The answer to that is yes, but it's not. It's a part of a solution, right? It's a part of a solution. It is not the solution. There is no the solution, right? Except for to say, wait a minute, we have to honestly, objectively look at this and create a strategic plan. So let's look at the 5 zip codes of Buffalo. So you say, well, wait a minute. You know, I showed to Buffalo in 2008, and this became obviously recognizable to me, right? Mm-hmm. And it was obviously recognizable to others. And we had to create the Buffalo Center for Health Equity initially started from the task force to begin a dialogue when everyone knew this was happening. So you mean that our health systems, our hospital systems, our university, which receives money from the state, our cancer center, which receives money from the state, all this stuff is going on, and no one said, wait a minute, we need to fix that. Let's create a strategic plan. There is still no strategic plan to fix it. There is no strategic plan. There's no conversations about it. Yes, there's conversations being led by the Buffalo Center for Health Equity. Yes, Tim Murphy's group, Dr. Murphy's group, now we're doing research, but that's not a strategic plan. A strategic plan is when the people of power, the people with resources, say, wait a minute, there's only one grocery store for 130,000 people? We could change that tomorrow. You mean to tell me that 40% of the Buffalo schools students are graduating not at level for reading, writing, and arithmetic? We can fix that tomorrow, because guess what? It's not happening over there for a reason. All right? So let's do what they're doing. All right? And not make an excuse about it.
And fixing each one of those problems would fix the problem, the bigger problem.
Correct. Correct. So it solves all of it, because the reason I keep connecting everything together, because everything is connected.
Sure.
Right. So I'm not just a doctor. I'm not just black. I'm not just a male, right? I'm all these things that help make Willie Willie, and the Buffalo are all these things that help make Buffalo Buffalo.
I want to ask you more about that. Forbes magazine just this past week came out with an article, how CMS, the Centers for Medicare and Medicaid Services, how CMS missed an opportunity to advance health equity and what can be done about it. And their basic premise of the article is these federal groups that to some degree regulate hospitals, or at least certify them, and then based on their ratings figure out what sort of reimbursements and what sort of funding they get, they needed to put in that rating system some sort of action item that says, hey, are you addressing health equity? Does this article make sense to you? Is that something the federal government could do just like that?
So I haven't read the article in detail, but the concept makes sense to me. I also sit on the board of the Joint Commission. We're one of the agencies that CMS uses to evaluate the quality of healthcare delivery, right? So at a certain point, we have to change the metrics so that to make the system work better, okay, for everyone. So if it requires, and it should not, but it will require a process that says, listen, we're going to evaluate you based upon the outcomes of the community. That's what I'm saying takes that to a whole nother level, right? That's not saying, oh, you get to say, I'm doing A, B, C, and D about it. No, we're going to evaluate you based upon the outcomes of the communities in which you say you serve.
And the federal government and the Joint Commission are in some ways already looking at outcomes. How many of your diabetic patients die? How many of your appendectomies fail? That kind of stuff is part of the system. Yeah, exactly. Okay.
Take out the wrong kidney.
Yeah, all of that.
All those things.
And they could, if they really wanted to press it, factor in, hey, are you working on healthcare delivery to underserved populations?
Or are you looking to improve your outcomes in those communities? Okay, so that's and what I'm rephrasing it purposefully, because what we're talking about are outcomes. So right now, there are grants being written, proposals being written for decades, and they get money and they say, we're going to do X, Y, and Z. And there is no evaluation of whether or not they actually achieve those goals or not. They just continue to get money, all right? So, and you continue to say, well, we have great outcomes. So if you're in a community so no one's asked this question, wait a minute, if you're in a community that is 40% black, for example, why 90% of your patients are white and you're sitting in a black neighborhood? There are many institutions who are receiving federal fundings and good institutions, so-called good institutions, that are receiving funds, support from the federal government, who are sitting in black communities that they do not treat black people.
And why don't they treat them? I imagine the mandate of, and I'm just going to pick the name off the top of my head, not to indict them. Yeah. I imagine the mandate of CALIDA, though, is to serve probably a 7 or 6 county region. They happen to be located in a blacker neighborhood, but their mandate is the entire region. Are you saying they should be faulted for that?
No, what I'm saying is that let's evaluate outcomes, right? So,
and outcomes that are specific to certain populations.
Correct, and which you say you serve, which you're receiving. I don't think CALIDA gets federal money. I don't know.
Yeah, they might be a very bad example, but go ahead.
But I know who does get federal money. So you say, okay, this is your mandate. This is a mandate that you selected, right? That you chose. Okay, right? And therefore, we're going to evaluate you based upon that. That's what we do with sports, right? We do with the quarterbacks. Hey, I got a quarterback rating, right? You're supposed to pass the ball. Okay, great. People aren't catching your passes. So, right, you're not scoring touchdowns. So, therefore, we're going to handle this, right? So, if we treated everything the way we would treat our sports teams, and we said, wait a minute, what happens when your outcome stinks?
What is the passing ratio?
And your sports team? You get fired. You don't exist anymore, right? Yeah. We started with the Buffalo Bills, right? Win or go home, right? How they rule this. But in education, that's not the place, not the case. Healthcare, that's not the case. And what I'm saying, it should be the case, right? Let's evaluate your outcomes. And if your outcomes stink, then you need to go.
When you say certain places don't have the outcome that they need to, are you talking smaller clinics? Or are you talking bigger hospitals? Who specifically is the if I can even call him a culprit, the offender here?
And again, I'm talking about larger systems with resources that are receiving these resources. So we look at a institution, and again, this is beyond healthcare. This is across the board what I'm saying. We look at an institution that is struggling to keep its lights on, and we say, well, your outcomes are poor, right? Now, there's another institution right down the road that you're giving $100 million to, okay, right? You're giving $4 million here, and you're nitpicking them to death, right? And you're giving $100 million over here, and you're not overlooking what they're doing at all, right? Right? And you're not asking the questions. So the question becomes, why you're in a black neighborhood, you're in a black community, and 90 and 95% of your patients are not black. So blacks make up 4% of your patients. Let's look at your hiring and firing practices of blacks, because that matters, right? Hospital systems are, when you look at health system, the system is a delivery system and an employer, okay, right? As an employer, they're impacting the health outcomes of the community based upon who they hire, fire, and promote, okay, right? So that needs to be addressed as well. So when we start talking about real solutions to this problem, we need to take this to a whole nother level, and we need to bring in people who actually truly say, let's come up with a real strategic plan, and let's not fight over that plan.
What do you mean by that? Is there currently bickering?
No, what I mean by what I'm talking about, when I'm saying that fight over the plan, let's look at our society, right? That's what we do. We fight, someone says, for example, current president says, we're going to give the black farmers $4 billion. Now, and people get upset. Oh my God, look, they're taking it from us. We should have that. And you say, well, wait a minute, dude, you didn't, the truth of the matter is he was doing that because when they dished out all the money to the farmers, they didn't give it to the black farmers. They didn't give them one penny. So he says, well, so we didn't give them money like we gave you. We're going to give them the money that they should have gotten when we gave you the money.
And that's the kind of discussion you don't want to see happening. When you say there shouldn't be arguing, you don't want that kind of back and forth.
No, back and forth. Right. Let's come up with a solution and let's fix it. Because here's the thing. When our food supply is low, it affects all of us. When we have 40%, so you have a 76% high school graduation rate. That's just high school graduation. That's graduation is the lowest level, period. Okay, right? And then you say, well, what's our rate of those who are college prepared? What, 20%, maybe 15%? You have a 40% group who can't meet the minimum standards. That has a negative impact for the individuals, for the family, and for the community. So that blight to the system negatively impacts everyone. Not just them. Why do I care? Because it impacts me as well. Sure. It impacts the white person in the suburbs as well, right? So, and no one says, well, what are you going to do? Give them some more money. I want to get people off welfare. Okay, great. Let's create jobs then.
Yeah,
right? Great. I don't need welfare. Why? Because I got money.
Dr. Willie Underwood is with us. He's the director of the Buffalo Center for Health Equity. He's chairman-elect of the Board of Trustees of the AMA. And I really do see this kind of as a bifurcated discussion. Certainly we can look at the delivery systems, but you've just now started to branch out into what, to my mind, is a more traditional discussion, the social determinants of health. If you address the problems in the community that are causing the health problems, you can therefore be addressing the health problems.
Correct. So look, I'm a student of history. Japan was decimated. We dropped 2 atomic bombs on them, right? We pulled their leaders out in the streets and shot them. Right? And within a few decades later, they were a powerhouse economic power.
Because of the Marshall Plan.
And then the Japanese ran with it and basically says, okay, we're going to build certain industries, and every decade they focus on an industry and built it. Okay, they became the captains of the steel industry on an island. They don't have any of the substrates to make steel, and they were able to do that. So how come we can't do that for the east side of Buffalo?
Is it a lack of political will, or, as you alluded to briefly earlier, lack of a master plan, lack of strategy?
I think it's both.
Or all of the, okay.
I think it all comes together, right? We want to say these things. We're going to figure out how to raise the educational level of this city and create productivity, create creativeness, create jobs, create wealth, create opportunities for everyone. You're going to figure it out, or we're going to stop putting money in you, right? Because something is wrong.
The ones with the money, more often than not, or at least with the deepest pockets in this scenario, are the feds. Is that where it has to start?
Which one's the chicken or the eggs? So this is what I think. I think in certain times in our society, let's think of healthcare. I believe that if we came up with a real strategic plan on how to improve health outcomes in this region, we would bring the payers would love it, and the federal government would love it. Compared to let's not be victims and say, well, we can't do anything because we don't have the federal government. We need help from other people. No, it all starts with us. It starts with us saying enough is enough. As my mother would say, too much stinks. Let's solve the problem. Let's begin to bring the people together. If we need grocery stores, we could create grocery stores. What does that look like, right? How to make it happen. But right now, what we're doing is being, well, you got some people saying, why don't you throw some money my way? I'll come up with something. No, why don't you come up with something and we'll throw some money your way. Okay, right? You got to come up with something first. Yes.
And exactly. There are tiers of groups that are collecting state and federal money to do stuff, but the problem persists.
Correct. And to do what? I mean, because there's no big strategy. There's no strategic plan. So what does it look like? What does it truly take to raise the education level? And let's stop blaming the parents. Let's stop blaming the teachers. Let's stop blaming the schools. Let's all say, I'm all accountable here. We're all a part of this together. We're one community. And we're going to be a community that people across the globe will break their necks to want to live here, which raises everyone's property value, which raises the tax base, which raises buildings, companies, all that sort of stuff comes together compared to saying, well, we can't recruit people because we're in Buffalo. I heard that when I used to work in one of the hospitals here, that, oh, we can't recruit people. And I say, well, Mayo Clinic in Rochester, Minnesota doesn't have trouble recruiting people. So how do you have trouble recruiting talent?
And Rochester, Minnesota does have some climate issues that are worse than ours.
Correct. Because that's an excuse. Why did people who all lived on the East Coast of the country travel over 3,000 miles to get to the West Coast? Because they were looking for opportunities. Let's make Buffalo the land of opportunity.
My closing question in a lot of these interviews, I think people almost always answer the same way. But I'm wondering if, in light of the scope of the problems you see, are you optimistic?
Am I optimistic? Can they be fixed? Yes, because we created them. God didn't create this, man created this, right? So they can be fixed. Am I optimistic that we are going to fix them? No, because we're not doing anything.
Intent. I guess it sounds like you're saying intent has to be there.
Correct. And desire, and the true desire. Let's look at education, for example. There are data that shows that in kindergarten, Black students are advanced and they desire to learn at a higher level than whites. This is on average. And at the top of the list are Black males. By the third grade, that's gone. And by the seventh grade, they're 4 years behind. Whoa. So it's not them. It's not that the parents, right, that the child doesn't desire. They can't wait to go to school. They think it's, I remember how I felt as going in. I mean, I could not wait to start kindergarten. I thought school would be the greatest thing ever. And for a few years it was. And then I went to an all-white school and it was no longer that way. Not to harp on my personal experience.
Yeah.
But what I'm trying to say is that, so what are we doing wrong What do we need to fix, and how do we fix it in a real strategic, purposeful, the money is used purposeful. We're not doing Mickey Mouse things and getting a Mickey Mouse result. We're doing things that actually work.
And in that regard, do you say that the incident on May 14th is a catalyst? If there is not community will, if there is not political will, does a shooting change all that?
You know, it all depends on how we view the shooting. If we view the shooting as, well, this sort of thing happens, but if it's that, hey, listen, we're under attack and we're vulnerable and we need to come together and make ourselves less vulnerable. And what does less vulnerable look like? Does it look like armed guards to protect us in the future? Or does it look like that we're a more viable society? That's one way of looking at it. The other way of looking at it is taking it a little deeper and say, what is going on in our society that killing people is a solution? And it's such a solution that I'm going to live stream it, right? Because I want to show you that their lives have zero value. And where does that come from? And how is that allowed to exist? And how deep and strong rooted are those thoughts in this country? Because it takes a lot. So I'm not sure, because we haven't handled, no other place has handled that way.
Has the community reaction been strong enough, appropriate enough, robust?
So what's the reaction? First is mourning the deaths, right? Okay, great, people died. It's horrible. Then there's we're going to do some window dressing things that appease people so that we don't have an explosion. Okay, right? But when it's all settled, will people be in the exact same position they were in 5 years from now that they were in on May 14th, right? And the answer to that most likely is yes. Without a strategic plan, without implementation of that plan, without evaluation of outcomes, then in the end you end up with the same.
The old definition of an insanity.
Correct. So if you look at how we got here, there was a system in place to get us here. And it's going to take a system in place to get us out of here. You know, you got on one side, we got to transform the minds and hearts of people. And on the other side, we have to transform the minds and hearts of people, right? I mean, because we're all victims of this process that went on for hundreds of years, right? That has taught every aspect of our society, and it muddies every aspect of our society.
Dr. Underwood, thanks so much for your time.
Thank you.
Dr. Willie Underwood is the director of the Buffalo Health Equity Center. He's also the incoming chair of the Board of Trustees for the American Medical Association. You can get more information, by the way, at buffalohealthequity.org, or they're also on Twitter at Igniting H, like Igniting Hope, the conference they recently had, Igniting H on Twitter. This is Buffalo What's Next, our daily discussion program on race, education, and related issues after the top shooting on May 14th. Thank you for joining us here on WBFO and WBFO HD1 Buffalo, WOLN Olean, and WUBJ Jamestown. I'm Dave Debo. We'll be back here again tomorrow with our Producers Picks program, highlights of recent important interviews on Buffalo What's Next. Thank you for listening.